doctors. Today we are going to talk about cerebral palsy. So let's talk about what is palsy. So palsy is a word that is related to paralysis. Palsy is a word that is related to paralysis, and cerebral means cerebrum, which is the largest part of the brain. So cerebral palsy means it is the dysfunction related to cerebrum. It is the dysfunction related to cerebrum. But how you will properly define the cerebral palsy? So actually it is a non-progressive and non-curable condition of CNS. So how you will properly define the cerebral palsy? The cerebral palsy means it is a non-progressive condition. Non-progressive means the disease is not progressing further, and it is a non-curable condition. Means there is no any specific treatment is required in such a condition. So it is a non-progressive and non-curable condition of CNS. It's important. Now actually it involves the pyramidal system and extrapyramidal system. It involves the pyramidal system and extrapyramidal system, which helps in the body movement, posture and balance. So it involves the pyramidal and extrapyramidal system, which helps in the body movement, posture and balance. Now let's say we have a brain. Now let's suppose this is a brain. Now this area of the brain that is here, this area is called as cortical area. This area is called as cortical area of the brain, and maximum oxygen is required in such a place. So this area required maximum oxygen. So maximum oxygen required to cortical area. Why it is so? Because of high number of mitochondria. Because of high number of mitochondria. Now let's say if the oxygen supply is altered, what happens? If oxygen supply is deficient or altered to such area, to cortical area, so what happens? As we know that the cortical area, it is a motor area. So if the oxygen supply is deficient to the cortical area, so what happens? That the motor activity ceased. Motor activity ceased. Ultimately, it leads to the paralysis of the body. So I repeat, the cortical area of the brain, actually it requires the maximum oxygen. So if there is deficient occur, if the oxygen supply is deficient to such a place, so what happens? That the motor activity is distorted, which lead to paralysis of the body. Now this paralysis of the body, it ranges from minor to major. Like this paralysis, it could be minor and it may be major. Now the minor paralysis, it is called as clumsiness. It is called as clumsiness. The minor paralysis is called as clumsiness, while it may lead to the major paralysis, like in a condition of quadriplegia. And what is quadriplegia? It means paralysis of the four limbs, all four limbs. So this is important. Secondly, the cerebral palsy, it is a upper motor neuron lesion. It is important. Cerebral palsy, it is a upper motor neuron lesion. It means whenever there is paralysis occur, that paralysis is called as spastic paralysis. Always there is a spastic paralysis which often lead to a hypertonia, and it may lead to the hyperreflexia. So cerebral palsy is a condition where there is an upper motor neuron lesion, and it leads to the which sort of paralysis? That is spastic paralysis, and it leads to hypertonia and hyperreflexia. Now, if this condition, if cerebral palsy is deteriorated, if the condition is more worse, so it may lead to another condition that is called as mental retardation. So it is important, if the condition of cerebral palsy is deteriorated, it may lead to a mental retardation. In a mental retardation, the IQ level of a patient is less than 70. So that's all about the general overview regarding cerebral palsy. Now let's discuss the certain causes of cerebral palsy. So what are the causes of cerebral palsy? So the causes of cerebral palsy, it is divided into three major groups, that is prenatal causes, perinatal causes, and postnatal causes. So what are the causes of cerebral palsy? It is divided into prenatal causes, means during pregnancy, perinatal causes, and postnatal causes after delivery. Now, the most common cause of cerebral palsy, that is prenatal causes, like during pregnancy, and it contributed as 80%, while remaining 10% it is contributed by perinatal and postnatal causes. Now, what is the most triggering factor behind the prenatal causes of cerebral palsy? So the most common cause of that is called as hypoxia. That is called as hypoxia, and as I told you earlier, that the cortical area of the brain, it requires maximum of oxygen. So if the supply of oxygen is deficient, so the cortical area is disrupted, which lead to the paralysis. So the most triggering factor for the cerebral palsy, that is low oxygen. So it is always very, very important that what is the most important and what is the most common cause of the cerebral palsy. So the answer is hypoxia. Hypoxia is the most common cause of the cerebral palsy. Also, certain other causes are also included, like maternal torch infections, like toxoplasma gondii infections. Certain other agents may be involved in it. R stand for the rubella, cytomegalovirus, and herpes virus. So these are the maternal torch infection which could lead to a condition of cerebral palsy. Also, there are certain teratogenic effects may play important role. Teratogenic effects, it could also lead to cerebral palsy. Teratogenic effects means that, let's say, if mother take certain drugs, so those drugs affect the baby as well. So that is called as teratogenic effects. Now, also exposure to radiation. It leads to the prenatal cause of cerebral palsy. While if you talk about perinatal causes, it includes birth asphyxia or certain complicated deliveries may lead to cerebral palsy. While if you talk about a postnatal causes, and postnatal causes, the main cause is, that is head injury, that is head traumas. Also, it included certain infections like meningitis and encephalitis. So I repeat, the causes of cerebral palsy divided into three spectrum, that is prenatal, perinatal and postnatal. Prenatal, the hypoxia, maternal torsion infection, teratogenic effects and a certain exposure to radiations is the major cause of cerebral palsy in prenatal causes. And always remember that the most common cause of cerebral palsy is hypoxia, while in perinatal causes there is birth asphyxia, complicated deliveries. Also in the postnatal causes there are head traumas and certain infections like meningitis and encephalitis. Now what are the protective factors? Now always remember that the protective factors are magnesium sulfate, certain antibiotics and corticosteroids. So these are considered as protective factors. So now let's talk about certain types of cerebral palsy. Now cerebral palsy, it is divided into 4 types. So how many types of cerebral palsy are there? There are 4 types of cerebral palsy. Yes, there are 4 types of cerebral palsy that are. Now let's discuss the types of cerebral palsy. So the first type of cerebral palsy, this is called as spastic cerebral palsy. That is spastic cerebral palsy, which is also called as hypertonic cerebral palsy. It is also called hypertonic cerebral palsy. Second, there is dyskinetic cerebral palsy. Dyskinetic cerebral palsy, which is also called as etioloid cerebral palsy. Etioloid cerebral palsy. Third, there are ataxic cerebral palsy. This is called as ataxic cerebral palsy. While the last is, that is mixed type of cerebral palsy. That is mixed cerebral palsy. Now there are 4 types of cerebral palsy, that is spastic cerebral palsy, which is also called hypertonic cerebral palsy. And always remember that the most common type of cerebral palsy are spastic cerebral palsy. Usually it contributed as 60%, while this dyskinetic cerebral palsy, it contributed as 30%, while remaining 5% are ataxic cerebral palsy and mixed type of cerebral palsy. So which is the most common type of cerebral palsy? That is spastic cerebral palsy, which is also called as hypertonic cerebral palsy. Now let's discuss each type of cerebral palsy in detail. Now let's discuss the first type of cerebral palsy, that is spastic cerebral palsy. Now the first is, it is the most common type of cerebral palsy, and it is a upper motor neuron lesion. Actually it is an upper motor neuron lesion and can't receive the GABA. It can't receive GABA. And GABA is actually, it is the inhibitory neurotransmitter. GABA is actually the inhibitory neurotransmitter. So if it can't receive the GABA, it means that the electrical impulses are generated highly. So there are excessively electrical impulses generated, which ultimately lead to the increased tone in the body, in body. And that's the reason, which is called, it is also called as hypertonia. Increased tone in the body means hypertonia, and that's the reason, because of this hypertonia, it's also termed as hypertonic cerebral palsy. Now it actually, in spastic cerebral palsy, it affects the pyramidal tract. Actually it affects the pyramidal tract, which helps in muscle contraction, It means if there is defect occur in the pyramidal tract, so the muscle contraction will be affected, so they ultimately lead to the paralysis. Now, how the patient actually presented to you if one is suffering from spastic cerebral palsy. So what are the symptoms of the patient? So let's discuss the symptoms. So, and the symptoms, the most important symptom is that is called as scissoring gait. So that is called as scissoring gait. Now in scissoring gait, the knee and thigh, they are pressed together. The knee and thigh, they are pressed together, are actually the knee and thigh, they are coming each other while one is walking. So it is the most important feature that is related with the spastic cerebral palsy. So here the knee and thigh, they are pressed together. Let me write it. In scissoring gait, the knee and thigh are pressed together. They are mixing each other while one is walking. Now, this is the most diagnostic feature of spastic cerebral palsy. Now, what are the other certain manifestations? There could be a paralysis as well. Obviously, there would be spastic paralysis, as it is upper motor neuron lesion, so there will be always spastic paralysis. Now, this paralysis, it may be manifested like in the form of there could be a monoplegia, there may be paraplegia or quadriplegia and diplegia. So actually the spastic paralysis are in the form of monoplegia, means there is paralysis in one limb. Paraplegia means when one is actually unable to move voluntarily the lower parts of the body, and quadriplegia means if there is paralysis in four extremities, and all four extremities, that is termed as quadriplegia. While diplegia is just similar to paraplegia, but the difference is that there is symmetrical paralysis occur in both sides of the body. So the most important symptoms of a patient is scissoring gait and the spastic paralysis in the form of monoplegia, paraplegia, quadriplegia and diplegia. So these are the important symptoms of the spastic cerebral palsy. Now second, let's discuss the second type of cerebral palsy, and that is called as dyskinetic cerebral palsy, which is also called as etiology cerebral palsy. Actually, it affects the extrapyramidal tract. Here it affects the extrapyramidal tract and also basal ganglions, which helps in the body movement. Now, and second type of cerebral palsy, that is dyskinetic cerebral palsy. Here it affects the extrapyramidal tract and basal ganglion, which helps in the body movement. It means if there is defect occur, so the body movements will be disturbed. Like how the patient is presented, what are the symptoms of dyskinetic cerebral palsy? There is worm-like movements. Also, there is dystonia. What is dystonia? It is the uncontrollable movements of the body. It is actually the uncontrollable dance-like movements. So that is dystonia. So hope you get the first two types of cerebral palsy. Now let's discuss the remaining two types of cerebral palsy. The third type of cerebral palsy, that is termed as, let's discuss the third type of cerebral palsy, which is called as ataxic cerebral palsy. Now, an ataxic cerebral palsy, here it affects the cerebellum. And what is the major function of the cerebellum? that is coordination and posture. Coordination and posture. So if the cerebellum is not working properly, so the coordination and posture will be disturbed. And the last type of cerebral palsy, that is called as mixed type of cerebral palsy. Now always remember a mixed type of cerebral palsy, it is the combination of spastic and dyskinetic cerebral palsy. Now mixed type of cerebral palsy, it is the combination of spastic cerebral palsy and dyskinetic cerebral palsy, but it not involve the ataxic cerebral palsy. So it is very important that the mixed type of cerebral palsy, it is not the combination of all remaining three types of cerebral palsy. Always remember, the mixed type of cerebral palsy are the combination of first two cerebral palsies, that is spastic cerebral palsy and dyskinetic cerebral palsy. So students, that's all about the four types of cerebral palsy. Now let's discuss what are the signs and symptoms of a patient, like if someone is suffering from the cerebral palsy. Now let's discuss the symptoms of cerebral palsy. So there is extreme irritability. There is extreme irritability and crying. So the patient is suffering from extreme irritability and crying. Also there is abnormal posture. There is abnormal posture, like in the form of, let's say, in a condition of asphyxia, in which the spasm of the muscle causing the backward arcing of the head, neck and spine. So that is called as asphyxia. Also in such a condition there is hypertonia, increased tone, there is hyperreflexia. So also the very important symptom is that all the developmental milestones, they are delayed. So developmental milestones are delayed, and in a child the primitive reflexes are persist. So there is persistence of primitive reflexes. So there is persistence of primitive reflexes. Also there are feeding difficulties and there is toe walking. So students, the symptoms are, there is extreme irritability, there is extreme crying, there are abnormal posture like asphyxia, there are hypotonia, hyperreflexia, the developmental milestones delayed, there are persistence of primitive reflexes, feeding difficulties. The most important features are, that is hypotonia, developmental milestones when they get delayed, and when there are feeding difficulties. So these are very important symptoms of a patient. Now how you will diagnose a patient of cerebral palsy? Now in the investigation option, the most important is, that is clinically assessment. First, the clinically assessment is important, like if there is delayed milestones and if there is feeding difficulties in hypotonia, so we can think about the cerebral palsy. Also we can do the CT and MRI. We can do CT and MRI after 18 months of child age. So yes, so an investigation, the clinical assessment is important. Also we can do the CT and MRI after 18 month age of the baby. Now how you will treat the patient of cerebral palsy? Now let's discuss the treatment option. What is the treatment option in case of cerebral palsy? Now, as I told you earlier, that the cerebral palsy actually it is the non-progressive and it is a non-curable condition of the CNS. I told you earlier in the start of the lecture. It means that there is no any specific treatment is required as the disease is non-curable. But there are certain approaches are given and study, so we have to deal the patient likewise in that manner. Like the most important is there are multidisciplinary approach. There are multidisciplinary approach. It means the multidisciplinary team actually it is important which actually provide the speech therapy, educational therapy and behavioral therapy in order to enhance the quality of the life. So the most important is that the multidisciplinary team is provided in order to educate, in order to provide the speech therapy, educational therapy and behavioral therapy in order to enhance the quality of life. So this is the first approach. Also the safe environment is important. What does it mean? Safe environment means that I'll always remove any sharp object from the surrounding of the baby. So the safe environment play important role. Thirdly, there are certain muscle relaxant play important role. And what are the action of muscle relaxant? As it decrease the spasticity. So what are the drugs that are coming under the category of muscle relaxant that play important role? That is actually succinylcholine. You can give the succinylcholine. Also dantrolene. So these play important role. Now, and the last there are physiotherapy is important. So physiotherapy actually it is the mainstay of treatment. Physiotherapy it is the mainstay of treatment. So I repeat, the treatment option is the first is multidisciplinary approach. After that, safe environment. Thirdly, you can give muscle relaxant and the physiotherapy, which is the mainstay of the treatment. So students, that's all about the cerebral palsy. So thank you so much.